Hello, class. My name is Stephen Chevalier. And just to summarize what we have done so far up until this point in the class, we have done a pre-test to assess your baseline knowledge regarding our topic of choice, which is hand hygiene and its importance to us as healthcare workers. We've also heard from the local infection control nurse and observed and listened to her recommendations regarding proper hand hygiene techniques and recommendations from evidence-based practices. And we've watched a great video from the World Health Organization on hand hygiene recommendations. Now, before we break into small groups to do some learning activities, let's assess your knowledge with some questions. I'm going to hand out clickers and we'll go through some of the questions together. Now log on to webclicker.org and we'll get started. I will read out the questions to you and each of you can respond. Then it will show on the screen what percentage of you answered each question. We will then reveal the correct answer, thus learning together and being able to share valuable insights and answer questions along the way. And there will be 5 questions total. Now the first question is, how many patients contract healthcare associated infections each year worldwide? Is it A, hundreds, B, thousands, C, millions, D, billions? All right, let's look at the results. And most of you are correct. It is C, yes, millions. It's obviously a very important topic. And how many of you knew it was that to that scale? That's quite large. Does anybody have anything to add before we go on to the next question? No? Okay. Second question is, what is the most common way that healthcare associated infections are transmitted? Is it A, contaminated IVs, B, patient hygiene, C, healthcare provider hand hygiene, D, dirty hospitals? Okay, let's look at your answers. The correct answer is C, healthcare provider hand hygiene. Moving on to question number 3. What is hand hygiene compliance worldwide? Is it A, 29%, B, 39%, C, 49%, or D, 59%? And let's look at your responses. Yep, most of you got it right. It is B, 39%. Does anybody have any questions or anything they'd like to add on this percentage number? Was it higher or lower than you imagined? Is there anything that you think might contribute to this? Is there anything that you've witnessed throughout your career or your exposure in the healthcare community as to why this may or may not be correct? Very good, thank you. Let's go on to question number 4. Wearing gloves is an appropriate substitute for hand washing. This is a true or false question. A is true, B is false. And the correct answer is indeed B, is wearing gloves is not an appropriate substitute for hand washing. We must always wash our hands whether we wear gloves or not. So the correct answer is indeed B. Number 5, is it better to use soap and water rather than alcohol-based formulation in the following situations? A is when hands are visibly soiled. B, soap and water is always better. C, Clostridium difficile is strongly suspected. Or D, A and C. Let's look at your answers, and you're correct. The correct answer is indeed D, A, and C. All right, I think you all did a fantastic job and a lot of great work on this assignment. Just as a disclaimer, all of these teaching materials were presented to a diverse work group involving a diverse shared governance council who reviewed all the teaching materials so that we could ensure that the information provided could be translated to a diverse student body and that we covered all the practical angles to this. Now, let's reinforce some of these things by breaking up into groups of 4 to 5 and starting our first activity. I want each of you to practice washing your hands with both soap and water and the alcohol-based formula, watching each other, giving feedback according to the World Health Organization handout I passed out earlier. You all did a wonderful job, and thank you so much for participating in this activity. Your evaluations will be very much appreciated. Thank you.